only have one. You gotta take good care of it. See? That's it. Quite well with this neck.
Feeling better. Doing exercises, definitely. Workouts here are working too. So before, I was going like this and like this. Feel better. My leg. Then I was going back, front, back, front. Now I go around like this. It's all exercise for the ankles. Let's get my people. These are the different tools that Dr. Alex uses for the Graston technique. Heavy, this is heavy stuff. This one goes like this, goes like this. This little small one here. They're all pretty heavy metal. Ooh, I don't know how that goes. And ooh, this one in here too. And we're working over here. Oh, just a little bit more. Just working on a little bit more. Anyways, Graston technique, learn it. This is what gets you better, especially if you have ligament pain. We'll be working on me soon. Yay. Hi my people, GizzyCredit here. Recovery video 5?
I would say, yeah. No,
5?
Visit
yeah,
5.
Yeah, visit 5. I did 3. I posted the new videos on Facebook. On Facebook, and I posted the new videos on YouTube as well, so they can see the progress of it working. So I've been working out.
Okay.
So if people follow me, they see that I've been working out. I've been doing the exercises. What do you call it? Moderation?
Moderation.
No.
Good form.
Good form and not that much.
Like jerking. Hyperextending the joint.
Yeah, and if I'm supposed to do this, I do something else. What do you call that? Different technique.
Different technique. Okay.
Different
form. He's modifying the form.
Modifying the form. This is what I wanted to show you. That every time I take a shower, you know, my head, and then I like to put the towel right here.
Yeah.
And then I like to go put the towel behind me like this, and go with this side right over here. This side right over here. When I go like this is when I feel it.
Okay.
Right there. Like
I know inside. All right.
I know that if I'm gonna be 100%, if I'm good, if I'm doing like this. Now, I wasn't able to do this before.
Okay.
But I still feel a little, like that little last bit is like.
All right, so he's got that last annoying bit only going this way.
Only going this way.
How about going up?
Well, going up, I don't have it, but I do tend to get sore, like the exercises that I've been doing, because now I have to start.
That's fine. Soreness is good.
Soreness is good.
We don't care about soreness. That means the muscles are working in a normal pattern. So soreness is good. Pain, that's what we focus on. We care about if you're having pain in any of the motions. So,
oh, no, no. But I see that if I don't have the proper form, putting the ball up, the wall balls.
Yeah.
Because it's not about holding it, it's about coming down and catching it.
Right.
That's where the injury can occur.
Yeah. So we're learning here, you know, Gizzy is gracious enough to teach us about what's happening throughout his weeks, and he's learning. This is what we like every athlete to learn. As you're recovering from an injury, you want to come back smarter. You want to come back knowing a little bit better how you're going to use your body in your sport. So whether you're playing soccer, or you're doing CrossFit, or you're lifting, you want to lift properly, and you want to pay attention to your form more and more, so that you don't run into the same problem again. We want to fix you, but don't run into the same problem again.
Now, if you could touch me right here and go like that. No, right where my finger is at.
Yeah.
Right, but then go like that, like
in the groove.
No. Oh yeah, right there.
That's the one you feel when
That's
you come
the one I
across
feel
here.
when I come across. Oh, yeah, right there.
Okay. All right. So for those of you following,
means
he's pointing right to the injury. All right, go ahead.
Okay. And then you see the tape still lasts.
The tape lasted a week, actually more than we expected. If you get 5 days out of a kinesio tape, that's phenomenal.
Okay.
If you get 3, that's really ideal. But if you get 5, that's a bonus. So, terrific. All right, so let me turn this way. So now, here we go. We were dealing with the deltoid sprain, and we were dealing with some of the pec sprain. Now, move your arm in again, like as if you were gonna grab a towel, and point with this hand exactly where you're feeling the pain.
It's right inside.
All right, I'll palpate it and you'll let me know.
Right. You saw that right there?
Is it there or more?
More right
there. All right,
more in the bottom. Oh,
right there. Okay, so what we're doing here is he's pointing to this area, which is still a little bit part of the pec.
Oh,
okay,
right
there. Upper part of the pec. That's where he's pointing.
Oh, so can that be that it's sore?
Part of it, but
but it's right there.
You're feeling when you move the shoulder in, right?
Yes.
So when you're gonna go grab inside, you feel that pain right there.
Yeah.
Right? Okay.
Oh yeah. See, for the more right now. That's it.
So this is where the tissue and this is where the muscles are dysfunctional, right in this area. So we're gonna get to work. I'm gonna work in this area. We're definitely gonna do some pressure points today. But this is the last bit, exactly what you're talking about. The last little bit, right in that section.
Yeah.
Okay.
Almost there. Almost.
So he's almost there. He's got pretty good motion. There's that little last
it's just that little
nagging thing. So we're gonna get rid of that.
Okay, good.
So today we're going to do a combination of our instrument-assisted soft tissue. There's different techniques. One of the famous ones, Graston technique, my colleague, factor technique. And this is basically, we're going to take his tendon, we're going to bring it through motion, and we're going to work on it. That way he regains his capacity.
Okay. It's right there, doctor.
Right there.
Oh, right there. It's somewhere in between where you end and where you start.
So I'm going to go through here. I'm just going to get a general feel how the tissue is feeling from the first time.
You know, so I don't feel anything right there.
Nothing.
But
so
when you...
The first time, this was all red, all across in here. This tissue is back to its normal state.
But it's right there, doctor, right?
There's a little point, and this is why we're going to do pressure points.
Oh.
So we've gone from very broad injury, we're getting right down to the very small specific parts of it. And again, I want to check in here just to make sure that we got your deltoid fully functional. And
I think that's pretty good because I've been having a good time working out.
Yep.
But I respect the weights because of the injury.
Yep.
So I'm like, you know what? This time I'm not going to even try and put that much weight. I'm just going to relax it and go into it little by little.
Little by little. This is the right words here. We got to go back to your sport little by little. All right? There's no sense in trying to do heroics, okay, and hurting yourself and going back too quickly. That's major error number 1 of all athletes. They want to get back so fast, so quickly that they get re-hurt or they don't allow their body to heal well.
There you go.
Come in. So, for those of you following, you could see my job is complete here. Let's just take a closer look here.
Okay.
There's not much to do in here for him anymore. This is looking phenomenal. The fibers feel great.
Yeah.
Awesome. So we're gonna get to that trouble spot for him, right across in this area. All right.
If the trouble spot keeps hurting, do you think that surgery or something might? No?
He's not a candidate for surgery. People who are candidates for surgery are people that really can't lift anything. We've had an MRI. They almost are practically dislocating. They can't pick anything up. I mean, something really disastrous. That's when we'll go to surgery. Okay?
All right, cool.
So he's not a candidate for that whatsoever. If not, he wouldn't even be working out. So
okay, good.
That's outside the question.
Okay.
All right, so bring the shoulder out like this. Let's see here.
Ooh.
So that's now he's singing already. So
do you have enough oil on that? Because it feels like
splitting. It was splitting. Now I'm purposely working very hard because that area is very deep. Okay, and look, you can see here, guys. All right, you see the redness right.
Oh my god!
Exactly where he's pointing to. So that's it, man. That's where it's at.
Oh my god!
It's all good though. We're getting it out. It's all good.
Oh, you still.
A little bit more.
Still need to be
5,
active.
4, 3, 2, 1. Okay. All right. Now, just so I can get a notion, bring it in again and just see how that feels.
So automatically, I'm supposed to feel better.
You'll feel better. Let's see.
I mean, I do.
10% better. 20%.
It's 10%.
Huh?
When you want to see Luisa?
She's 2 times a week. All right.
It's
for the next 8 weeks.
8 weeks.
I still feel a little tingly, but I do feel. But I'm putting it all the way.
You're all the way through.
Now I'm all the way through.
That's good.
Yeah.
So
Before
actually, what I want you to do is keep it there. Keep your arm there again. Okay.
Ooh.
And let's see if I can work in here.
Oh. Wow. Active state.
Active state.
Oh.
He says the magic words. All right.
Active state.
Back in the days, the way that therapy was done very passively. So we just kind of lay you there and work on you. But we now know we get better results moving you, activating your muscles, especially in the direction where you're feeling pain. This is a big game changer in this kind of therapy. We have to take you through the course of where you're experiencing the pain. That way we can heal the muscle in that direction.
Okay.
That's why I'm doing this therapy now, while he's got his shoulder in this direction.
And this is the longest.
That's the best you've gotten there.
That's the best that I gotten. So it's definitely.
All right, so here we go. A little bit more here.
Oh, it feels good though.
It's good pain, right?
Yeah.
Yep.
Can you go a little harder right there? Right there? Or is it that I'm sore that I'm feeling it? Right there. Right there.
This section right up here.
Yeah. Oh. Oh, yes. Right there.
A little bit more.
Oh.
5, 4, 3, 2, 1.
Oh.
Okay, relax.
Oh. Am I supposed to feel like that?
Listen, I just worked you pretty hard.
Oh my god, yeah.
Okay. All right.
But it's supposed to be temporary.
Now, just kind of stretch it out for a moment.
So I relax. Okay.
All right, and just bring it in, and let's see how your range is. Practically almost the same range.
Almost the same range. No, that was.
Wow.
I'm putting it all the way.
Definitely.
I'm still feeling a little bit, but it's probably because you worked on it.
Yeah. Yes. So again, what we expect to see is number one, 2 things we expect to see. We expect to see less pain in the motion, and then number 2, we also expect to see better range. So he was able to bring his arm further out, almost touching his back over here, similar to this one. So we're looking at good symmetry for both of them. All right.
Up to here. You see how this one kind of goes up to here?
Let's do the other one again. So we need probably about an inch.
Wow.
Right?
Yeah.
We need about an inch.
Yeah.
So that's good. Now I'm going to do one more thing. We're going to do a pressure point, and then we're done. I can already see. You also have to know when to stop this therapy. All right. So right now,
okay. So it's not all just.
It's not how long you do this therapy. It's how the reaction of your skin is.
Wow.
So I also pay attention to that when I'm doing this kind of therapy. So lay on your back.
Okay. This is why it may take time to heal.
That's right.
Okay.
And again, one concept that I hope everyone gets out of this is we're having him heal as he's working out. So this is a good thing.
Yeah.
So he's not really interrupting a major part of his workout. He's not stopping completely.
Oh no.
So this is a good thing. All right. And I'm sure every athlete can appreciate that as well.
Oh.
Good there. All right. So
There.
let's bring this across here. So right here is where he's gonna get his pressure point. And again, what I'm feeling here, this is this tendon connection right into the bone. All right, so here we go. 5, 4, 3, 2, 1, 0. And I'm gonna do one more. And 5, 4, 3, 2. And we're gonna give him the bonus, the Gizzy bonus. Alright, here you go. 5, 4, 3, 2, 1. Perfect. Alright, so that concludes today's therapy. What I'm going to do at this point is I'm going to tape him. You lasered already, right?
No, I haven't lasered.
Alright, he hasn't lasered. So we're going to laser him. And at this point, I'm going to see him in 2 weeks. I want to see how his body does, how he's working out, how things are coming along. And I'm just going to give his body a little bit more time. So I'm stretching everything out to see how his body copes as well. So that's the next step for you in the shoulder.
All right, cool.
So let's clean this area up. Woo! All right, so here we are taking care of his ankle. This was the first thing that brought you here, right? It was your ankle, your shoulder first?
First off, I just come to a chiropractor because I work out and I work on my computer like this. Right. So I want to be able to get
proper posture.
Proper posture. And then you talked about BNI, about if you're feeling pain here, if you're feeling pain, you know what? I am. So that's where I came here.
All right, so here we go. We're going to work on his ankle. And for those of you following, we're taking care of the typical ankle sprain, which is out to the outside. All right, most people will sprain their ankle to the outside. That's most common. Sometimes to the inside, but mostly to the outside is the common. So he's at the tail end of this treatment with his ankle. So we're gonna go ahead and.
That's fine. Let's put it right there.
All right, we're gonna go ahead and finish up his ankle. I think today is the last day treating his ankle. Last time we treated him, it was fairly good. He's doing
no pain.
You're not feeling any pain. You're doing all of your exercises, Gizzy, no problem, right?
I mean, yeah. I mean, the only concern would be you talked about that the ankle also builds muscle.
Yes.
And how the muscle you can also have muscles on the ankle itself. So what concerns me a lot is just this little bubble right here that I don't know if it's supposed to be there or not.
So he's pointing to this area out here.
Yeah.
There's no pain here. This is just part of your structure.
Okay.
If we were to take this foot, you know what? Let's go ahead and take that shoe and take that sock out, and let's compare.
Okay. Because I always thought before I got the injury.
Don't you like his socks? Look at that. Unbelievable.
Before
good choice, Gizzy.
Before I buy my shoes, because I believe that.
So turn this way so the camera can see. So he's got practically the same thing here, not quite the same. Let's come around. A little bit more out here, okay? But this is nothing painful, right?
No, I don't feel anything.
You gotta remember, we're not symmetrical, okay? We're not designed to be equal left side or right side. To the naked eye, and for most people, yes. But our bones, you know, you have one foot that's a little bit larger than the other, a little bit longer than the other. We're gonna have some things that are not symmetrical in our body, and that's completely normal. Okay. So this I wouldn't worry about. This is nothing bothering you. I'm touching it. There's nothing going on in there.
Okay, good.
So rest free, okay?
Okay.
All right, so now let's get to our work here. We're gonna work on the ligaments. And there was one particular ligament he was having a hard time with. Let's see how it behaves today.
I mean, I feel the thing going.
Yeah. If you feel the instrument coming through, I don't really care about that. That's not causing you pain. Now we're gonna go. I know it's this piece here.
It's.
How is it? See, he can't even tell me right now. I'm passing this metal right through that ligament, and it's
like the last times.
Like the last few times, and you're not feeling really anything here.
Correct. I mean, right.
Feeling something here?
Move. Oh, it's somewhere around there.
Okay.
Somewhere around there.
All right. So we're gonna go through it, and we'll see if there's anything
right there.
Right there.
Yeah, right there.
Okay.
Oh. Let me apply more pressure there. Oh.
Now I'm purposely applying the pressure, very tiny spot right there.
Oh.
And he's starting to sing his opera.
Ooh. Oh, yes, it's right there, doctor.
All right, so now we need to treat this with some pressure. Okay. All right, so let me turn around. All right, and we gotta get really
yes, it's right there, doctor. Oh my God.
Okay. And we're gonna do a pressure point here. 5, 4, 3, 2, 1. Okay. Let's see how he's doing on the upper part of the ligament. Any pain here or just pressure from my finger?
No, pressure from your stuff. Pressure.
That's it.
Finger,
so
yeah.
Here, this is fine.
It's right there.
So one little sector over here. 5, 4, 3, 2, 1, 0. Okay. You showed them the Bozu already?
Bozu. Yeah. That's right there.
All right. Now, some of you may see here. Okay, we got a little indentation. That's normal. That's just part of the treatment. Okay.
Okay.
So no need to worry about that.
Oh.
Right. This part is just pressure from my finger, right?
Pressure from your finger. Yes.
Okay. All right.
Oh, right there, doctor.
So I want to do one more pressure point in this area. Okay.
Oh, right there.
And that's pretty much it for today. Ready?
Okay. Yes.
And one more. And we're done. Finished.
Why is it that?
That's where you injured the ligament.
Damn. Why is it that the little bits?
There's a tiny piece of the ligament, okay? This one you did in the race?
Right? I had to. I don't know if it's probably something that I probably did, a long time ago that I didn't pay attention to it. Yeah. And I believe that that's why it's happening this way.
Okay. Now, you got to remember, this guy ran...
I ran a 200-mile race.
A 200-mile race.
A 5K.
Then a 5K. And then
a basketball game.
So he did a lot over here.
But look,
You're doing well. Your function's doing well.
And what I like to do also when I take a shower, which I pride myself in, is...
he prides himself in the shower.
I mean, when I like to go like this, and then I like to... Now, this foot is really good already, but then I like to go like this and go, and it doesn't hurt, doesn't do anything. So I really feel like it's getting better. Before, there used to be a little
very painful. Okay, just put that up here. Let's clean that up.
Okay.
All right, so, this ankle is nearly complete.
But I feel it a lot right now.
He feels that ligament, of course. Yes, I mean, this is painful work, but short-term work. So again, we're not here for half an hour, but it is painful. So we're gonna tape it up right now, And again, for those of you that have not heard of kinesio tape, one of the things we do here, this helps to get rid of the toxins. It helps to, it's like lymphatic drainage.
If a medical student is watching this video and wants to, you know, when they have to write the paper and say what is kinesio tape, what is it for? That's the what's the terminology?
One of the basic things, without getting too involved into all the garbage that gets collected after an injury. This helps to accelerate your body getting rid of it. So what we call lymphatic drainage is basically you getting rid of the toxins so that the body can dissolve them as quickly as possible. And that's all that kinesio tape does. It accelerates this whole process. Your body can do it, but when we put kinesio tape, it'll do it faster.
There you go.
Without getting too fancy, right?
Thank you so much.
All right, we'll see you guys on the next time. I hope you're learning.
Am I going to come back in a week or?
2 weeks. So we're going to see him in 2 weeks. We're going to space things out now, and then we're going to get to see how his body goes. And that's how we do the therapy here. We start out very intense, and then we start to space out until the body, and we also give the body time to heal. Okay.
How can they contact you?
I'm here at 201-861-2025. You can log on to dralexhernandez.com. And again, I specialize in spine and sports injuries. Thank you for listening.
Thank you so much, my people. Hashtag GizzyCredit. Feeling better, getting better. Thank you, and thank you, Dr. Alex. Definitely. Laser treatment, little by little. Right there. Laser treatment works. And then laser treatment for my leg as well. Show you guys. Right there. So this is now finished. Now it's leg time. Finishing up the session. Ice for 5 minutes on the shoulder. And ice right down there. So definitely feeling better. And can't wait to come back 2 weeks and let them know that definitely feeling more better. GizzyCredit on my hustle.